Today, we'll delve into the healthcare sector in our country. If we have to describe our healthcare in two words, it's expensive. But that's just one part of a much larger problem which only gets worse when we get into the details. There are more doctors registered with the MCI than ever. There are more hospitals than ever, and colleges are turning out more doctors than ever. Yet somehow the cost of healthcare is still skyrocketing. The most astounding aspect of the medical sector is that almost every single doctor, surely a vast majority of them, are determined to leave the country the first flight they can professionally catch. If you don't like living in this country, please, for God's sakes, please don't study medicine here. We have too few seats to accommodate the healthcare demand we already have. Think about it. If comforts, money, status are what you want, maybe, just maybe, medicine is not the profession for you. Because the fact remains, 90% of those who qualify can't get admitted because there aren't enough seats. That's a problem. What's the de facto answer? We have to increase the number of seats across the country, right? Sure, it'll help. It'll help in making more doctors, which in turn will surely address the high demand for doctors. But does that one step automatically reduce the cost of healthcare? Has it? Because they've increased the number of seats at a higher rate than the population growth, but no, the costs are still rising. There's a much bigger problem at play. On the one hand, owing to the tremendous financial burden they take upon themselves, the doctors can become compromised. On the other hand, the hospitals can become compromised owing to their prohibitive equipment costs and costs of operation. Running a hospital, which should be akin to running a temple, is now akin to running a shopping mall. You need to have a marketing team, spend money on the ads, you need to sell medical procedures like they're going out of style. The constant information flow from the social media and the internet is making the individual insecure. With our lifestyles, staying healthy is no longer normal. You have to spend enormous amounts of time and money around a workout schedule, a healthy food regimen, buy a fitness tracker that reminds you every moment that you're not healthy unless it says you are. And you know who's shouldering the biggest burden of them all? The doctors. The entrance tests, the long-term coachings, the long hours, the treacherous days, the unending years, more entrance tests, the painstaking PGs, the never-ending certifications, and the fellowships, and on and on and on. After so much, those bright-eyed kids, the doctors, lost their shine, lost their balance, and lost their purpose. There are no loud-speaking doctors, if you haven't noticed. They're not questioning the system anymore. They are just another employee part of the system, and they hate being a part of it like everybody else. On a lost path, they're stuck thinking, are they making more money than their neighbors? Are they driving a better car, owning a better home? They're not serving, they're working. There's a difference. The doctors lost the trust in the system that can no longer translate their services into saving lives and saving people money. So they are resigning to taking care of themselves. 1 crore for MBBS, 1 crore for PG. These are conservative estimates. The numbers will easily be higher. First 30 years studying, then they start taking salary. Let's say they have 1 lakh per month in savings. Mind you, this is not salary. These are savings after all the expenses. With interest, it will take more than 20 years to pay back the money. They're 50 by the time they're free to stand up against a rigged system that hurts the patients and keeps the doctors in financial shackles. Unfortunately, until such time, they remain as a part of the problem. In the pipeline that starts with the patient and that goes to the doctor, each and every part is broken, faulty, and leaking. It's leaking everywhere. How can we expect an effective and affordable healthcare when it's riddled with so many leaks? Few examples of leaks. The fully trained doctors leaving the nation is a leak. The extremely expensive schooling and training is a leak. The extremely expensive hospital equipment costs are a leak. The insane amounts of time spent on outdated modes of educating and training is a leak. The reservation system, as it is on every major system in the country, is a leak. The fact that we have to seek a specialist for every illness is a leak. The poor air, water, the food quality, the stress levels induced at work, and traffic are all leaks. The unreal number of middlemen in the pipeline between a patient and a doctor is a leak. The collusion between the insurance companies, the pharma companies, and the hospitals is a leak. These leaks in the system are destroying the healthcare in our country. And somehow, someone, somewhere is working to keep the leaks flowing and making a killing. How did we lose track of our lives, our health, and how do we take back control? There is no silver bullet in this problem. This is madness and it's a freaking mess. But there is someone who can make a difference. There is a way, a foolproof way we can solve this. The doctor. The doctor is our savior. Ask that kid, the 18, 19, 20-year-old kid who wants to be a doctor one day. Does he or she truly wants to be a doctor? If the answer is yes, teach them one thing. Teach them never to compromise. They'll end up saving us all. Jai Hind.